Hi, my name is Kelsey Getz, and the topic that I chose for my presentation is cerebral palsy. So before I discuss the ins and outs of this disorder, I first want to discuss what is cerebral palsy. So cerebral palsy, which is also referred to as CP, is a neurodevelopmental disorder that's characterized by abnormalities regarding muscle tone, movement, and motor skills. CP is also known as multiple developmental disorders of movement that are permanent and cause activity limitation. CP is attributed to injuries to the developing brain in the fetus or in an infant. So this can happen, like brain injuries can happen while it's still a fetus or when the human is an infant. It is a non-progressive disorder, but the expression of the disorder changes over time as the person grows and as the brain matures. So it is also the most common motor disability in childhood. So now that you know what CP is, let's talk about the signs and symptoms. So cerebral palsy is classified based on the type of motor abnormalities that are presented. So early signs and symptoms of CP include, there's three different categories. So the first category is neurobehavioral, which these different symptoms in this category would include irritability, poor sleep, poor visual attention, and frequent vomiting. The next category would be developmental. So different symptoms and signs that would be under this category are frequent leg extension, delay in disappearance of reflexes. So as a child, you automatically have certain reflexes, and as you grow, some of those reflexes will start to disappear, such as the reflex on the child's foot. So if you tap a baby's foot, usually their foot clenches. That is a reflex that people tend to grow out of. So someone with CP has a delay in those reflexes disappearing. And another symptom would be rolling over at an age too early. So usually in a child that's developing normally, they hit a certain milestone at a certain age, while with CP, these milestones could be presented too early of an age. And the next category is tone and posture. Some symptoms in this category would be poor head control, hand fisting, increased neck extensor, and tongue thrusting. And you can see here in this picture, in stage 1, they work on tone management. Stage 2, contracture surgery. Stage 3, bony surgery. And stage 4, salvage surgery. So these are different musculoskeletal pathology in cerebral palsy. So that's just a little image to give you guys an idea of what that is. So next we'll talk about the 4 types of cerebral palsy. So the first type is known as spastic cerebral palsy. This is characterized by enhanced muscle tension and hyperreflexia. So if you look over at this diagram, it shows the different types of CP. So spastic is the most common by a lot, as you can see in the diagram. The next type of cerebral palsy is dyskinetic. This is characterized by movements tend to be involuntary, uncontrolled, repetitive, and stereotypical. So people with this type of cerebral palsy tend to have a lot of involuntary movements that they can't control, sometimes very repetitive if it's one movement constantly, and it's very uncontrolled. So the next type of CP is ataxic. This is characterized by loss of motor coordination, ataxia, trembling, and lowered muscle tension. And then the final and 4th type of CP is mixed. So this is when a person can present with characteristics from more than one type of CP. So if you look back at the diagram, spastic, like I said, is the most common, then mixed is the second common. Dyskinetic and ataxic are pretty similar with commonness, Dyskinetic is a little bit more common than ataxic. So next is epidemiology. So according to the CDC, in a 2016 study, about 1 in 345 people in the U.S. have been diagnosed with CP. The prevalence of CP continues to vary over time in different geographical locations, and that depends on several things, such as development of prenatal, intranatal, and postnatal care. That plays a huge role in the prevalence of the disorder. So in different geographical locations, people have more access to those different types of care when they're pregnant, so that can definitely play a big role. And CP is the most common factor, the most common factor that causes CP is injury to the brain before, during, or after birth, between the ages of 3 and 5 years old. So next we'll discuss treatments and medications. So when a child is suspected to have cerebral palsy, it is important for them to be evaluated for function and tone. Most common functional evaluation is called the Gross Motor Function Classification System, also known as GMFCS, which is based on age and performance. The most common tone evaluation scales are the Modified Ashworth Scale and Modified Tardieu Scale. Other treatments include physical therapy, oral medications, orthopedic interventions, and sometimes surgery. So if you look over at this diagram, it just talks a bit more about the treatments and the therapies. So there are several different medications that can control the symptoms and side effects. There's several equipment that people with CP can use to help them with their symptoms. There's different alternatives besides therapy or medication if people want to try and go a different route. There's several different therapies. Almost all of the therapies that you can think of, someone with CP can benefit from. And there are surgeries if a person does need that. So next is, how can CP affect exercise? So individuals with cerebral palsy experience many different physical difficulties when it comes to activity. Some of these include reduced muscle strength, poor ability to selectively activate muscles, and reduced joint range of motion. So people with CP tend to be more hunched over, more shriveled up. That's because, their joints are losing their range of motion, so they tend to be more in like a slouched posture. So it's really important for these people to work on stretching out their muscles, opening everything up so that they can eliminate that hunched over posture. It is very common for individuals with CP to use mobility devices such as wheelchairs, walkers, or canes that help them move around. This would need to be taken into consideration when performing physical activity. So if someone's looking to do some exercise, the therapist or the trainer would have to consider what their limitations are and if they're using a mobility device. So benefits of exercise and special considerations. So those with CP have an increased risk of osteoporosis and bone fractures. So exercises such as the leg ergometry and arm cycling may be beneficial to minimize falls and fractures. So it's really important to have people strengthen their bones and do some strength training because of that risk of osteoporosis and bone fractures. It is important to focus on balance to avoid falls, which can lead to fractures and other injuries. Obviously, if someone is wheelchair bound permanently, it's very hard to work on balance with them if they don't have mobility of their legs. Resistance training should be performed with the full range of motion, since, as discussed, range of motion is compromised. There is little evidence to support how CP affects exercise, but exercise may be beneficial to maintaining body function and to prevent chronic diseases within individuals with cerebral palsy. They should definitely take breaks throughout their session to stretch out their muscles, since, as I said before, their muscles tend to be hunched over and tightened. So throughout the session, they should definitely take a few breaks just stretch out the muscles, and they also need breaks too because a lot of times their cardio isn't as in great of shape because of they're either wheelchair bound or they're not able to move around as much as they'd like. So for my case study, I chose a client who is a 15-year-old female. She's diagnosed with cerebral palsy. She has lost most function in her legs, so she uses a wheelchair to get around permanently. Standing, she's about 5 feet 2 inches, and she weighs about 120 pounds. So the goals for this client are to strengthen her upper body muscles and to keep up with her range of motion since it's starting to decline due to her diagnosis. She is easily fatigued and sometimes has uncontrolled and involuntary movements. The client does not perform physical activity regularly, so she's pretty sedentary. So the exercise prescription that I created for this client, I am going to do some exercise testing with her since exercising is okay for individuals with CP. It just has to be usually a modified test. So the test that I chose to perform would be the wheelchair shuttle ride test, also known as SRIT. This test is a modified 10-meter beat test, specifically for individuals with cerebral palsy, to determine their cardiorespiratory fitness. So for endurance and aerobic training, I would do 2 to 3 days per week. I would start her at only 2 to 3 days because she's very sedentary to begin with, so we need to ease into it, and about 40 minutes per session. I would do a light to moderate intensity, so about 11 to 14 on the RPE scale, and 50 to 70 of her heart rate max. The client will perform the arm bike while seated in her wheelchair. Since she is unable to use her legs, the arm bike will be the most appropriate to use. She will do 20 minutes on, and then take a break, maybe around 10 minutes to stretch and break, and then 20 minutes back on. Then for strength training, I would do also 2 to 3 days just to ease her into it, 40 minutes per session. So also light to moderate intensity since she is a beginner, about 11 to 14 RPE on the scale, and 50 to 70% of her heart rate max. The client will perform upper body strengthening exercises using free weights or resistance bands. I would start her off pretty light with the weight since she is a beginner and she doesn't have much muscle strength right now. So we would definitely take short breaks throughout and rest and stretch the muscles. And these are all my references for my presentation. Thank you.